Oncologist for my appointment and my evaluation. But first, we have to meet with the technicians to go over basic information. Nothing's changed.
Well, I'm going to ask questions. Everything's the same with your medication?
Yep.
Thank you. That's good. How you feeling today?
I'm actually doing relatively well, except for like the neuropathy issues. So I just explained to Dr. Barry.
I'm glad. I don't like when you come in here with pain.
Yes.
You're too joyful and cheerful.
Joyful.
All right, my dear. He'll be right in.
Okay.
Okay, Penny. So
Hi.
basically, got the meat and potatoes of what I was going to ask you outside.
Yeah.
So listen, you're the boss. You're running the show in terms of because you know what you feel, and you know what you can do, and you know what you can't do. There is a definite truth to the fact that when Taxol stops, and you give it a chance to wash out of the system, things get better. Now, my rule of thumb, generally speaking, is if you get chemo today, you get it, and then you know what, Wednesday, Thursday, Friday, even Saturday, you feel it a little bit. By the time Sunday, Monday, Tuesday gets around, it's getting better. It may not be gone, but it's getting better. If that cycle is happening, we're okay. But if it is as bad on the day of treatment as it was, 3 days ago, 4 days ago, 5 days ago, and if it's worse this week than last week, that one's a biggie. Yeah. That is a reason to give you a little bit of a break.
It was, but then my husband gave me like the massages to get like circulation, and I'm like pulling the to my fingertips gently, and it really did help. I woke up with less pain. Also, I never tried the steroids. I'm not getting steroids, but I took it yesterday, so that might be. That might be. So let me try a week of...
Today we're not going to change anything.
Yeah.
But I want you to know this. And you got to be true to yourself.
Okay.
You got to be true to yourself. So this is about you and your quality of life. I'm now getting more and more confident that the breast cancer is going to be cured. Mm-hmm. You're going to lead a nice, healthy life without breast cancer. I do not want you to be reminded because of this crap of what you went through, or even worse, for you to be unable to do certain things as simple as putting this on your ear. You got a lot of years, you got decades of life ahead of you.
Yeah.
So if it means taking a week off and letting it wash out and then getting back and extending this by a week, I'm not happy about it, you're not happy about it, but it wouldn't be the worst thing in the world. So just know, and I'm going to go even a step further. If you're neuropathy, if you came in next week, I'm not saying this is going to happen because it doesn't happen that quickly. But if you came in a week or two from now and said, I can't, you know what? I'm unsteady on my feet because now they've gotten so numb and tingly. I have to hold on to things when I walk. When I go to the bathroom, I got to hold on to the wall. And I can no longer feel properly. Guess what? No more Taxol. You're done. You ain't going to get another dose. So because this is something that is so subjective and I've got to depend on you, I can't look at a blood test. I can examine you to some extent, but it doesn't really give me the true depth of what you're feeling. And everyone's different, You got people that will say what you're feeling, oh my God, it's so terrible. Then you got people that say, you know what, it's there, but you know what, it doesn't bother me. So I've got to really depend on you. You're young, you know your body, you know yourself. Yourself as well as any of my patients do. So I put a lot of trust in that. We're going to dose you today, but just know all these things. I need you to be smart and educated about it.
So what I was planning on doing was to take the 20 milligrams of the prednisone along with that what's that acid called? I ordered from Amazon.
Lipoic acid.
Okay, should be here tomorrow.
Good. Okay.
They
so
said
that's-
I was reading on the internet you should take it with something else, some acetate or something. But it's like sulfur. But
no.
I knew I would throw up if I smelled that. So I didn't order that. I'm going to try that plus the steroids and see if it gives me relief. Because if it gives me relief, then
Then we're okay.
we're okay. Because I only have to do 3 more doses after that. So I'm trying
You
to,
got it. You
know,
got it.
and it's not like I can ball my hands in a fist like this.
Yeah.
I can do that and clench it. It's just the fine motor things that are like
Yeah.
in here, like the carpal
Yeah.
tunnel area. It's
Yeah.
like, but if I massage it, and I also want to try massage and acupuncture, those type of things to see if it can help me. But you know what? We're at the home stretch.
I know.
And-
I know. And you kind of don't want to take a shortcut, and you don't want to extend it. Like I'm going to respect all of that, but you got to listen to what I'm saying. You
I
got to
know.
respect what I'm saying.
I will. So next week
This is
look
about
at it.
you. This is
We'll
all
look at it
about
for next
you.
week.
This is all about you, your life, your future, your health.
So next week we'll look at it, and if
Okay,
it's not good,
fair,
now why
fair.
did my feet swell like that? Did that happen with Taxol?
It can happen with Taxol. It can just happen because
I'm not getting around a lot.
you're not feet swell because of if it's one-sided, which it wasn't. You worry about a blood clot. If it's both-sided, it's because you're not ambulating as well.
Mm-hmm.
You're not as up and around as much, and if you're not eating enough protein. And protein is eggs, meat, fish, chicken, because that makes the blood vessels leaky. You know, and
Okay.
to some extent, the Taxol definitely it has an effect on your vasculature. It may make them a little more leaky. You know, any of those causes. Once we're said and done, it'll all get better. None of this should persist.
Okay.
Except if the neuropathy gets bad, it too will get better. I promise you. If today was dose 12, we would do it. You know, you would see next week, 2 weeks, it would get better, but it would get better quickly, and then it would slow down, and maybe 6 months, a year, it would slowly continue to keep getting better. But that is the one thing that it can plateau, and you can be left with a little something.
Okay.
A little something that doesn't bother you, fine. But a little something, because some people say, yeah, it doesn't bother me throughout the day. When I lay down in bed, I'm then really aware of it, and it keeps me up at night. That's terrible.
It's not. It just feels like what it feels like is if I was outside.
The tremors, I don't care. That's not an issue.
Okay.
The pain that you're having, that's not an issue. It is the numbness and tingling that persist. All of that will go away.
Yeah, it's like it feels like when you're outside in the cold and you didn't cover your hands, your fingers, and you're starting to get frostbite. Mm-hmm. The beginning part of that, that's what it feels like.
Right.
But
Gotcha.
I just feel like it's something I could deal with now. My eyesight has been worse on chemo. Like it
Can
bothers.
happen, but
And I brought shades because when I take the Benadryl, for some reason,
you get light sensitivity.
it's horrible. It's like I can't even look at the light.
It can happen. It can happen.
It never
It's
happened to me with
another
Benadryl before. Like
thing.
in,
It can happen, but you're getting it IV.
Yeah.
Remember, so you get
I'm like,
every milligram.
it's so bad.
yeah,
But I love it. It just makes me relax.
I know it chills you out, but but put the sunglasses on.
Now the only last thing is, how come my protocol doesn't have me with radiation? I don't need that.
Okay, so radiation is a post-op treatment. Radiation is a post-surgical treatment.
Okay.
If a woman has a lumpectomy as opposed to a mastectomy, you got to get radiation. If a woman has a mastectomy and there are no nodes involved and it was a small tumor, you don't need radiation. If it winds up being a big tumor or there were lymph nodes involved, you might still get radiation. So the decision for radiation is not a yes or no yet. Get the surgery done. Then we're going to talk about it. Most people will say if a person needed to shrink the tumor down to begin with, to be safe, they might benefit from radiation. So I'm going to have you see a radiation doctor, and we're going to let them make the final decision. So we're not saying it's not part of your protocol, but always remember whenever you do radiation for breast cancer, you never do it with the chemo. It is a set. Lung cancer, you combine them. But for breast cancer, you never do it at the same time because the skin will they add to each other. The skin will literally peel off of you. You can't do them together.
Because I just thought that if I'm going to get the mastectomy with the reconstruction, if I get radiation, won't it mess up some of the work?
It can mess up. So, but this is not something that's unusual. The reconstructive surgeon and the radiation doctor, they time it in a way that it's done. So what we need is maybe sooner than later, I'm going to have you see a radiation doctor just to
Because I saw
get
Dr.
them done.
Pio, and that's what I'm going to go to.
That's your reconstructive
reconstruction,
surgeon,
and Dr. St. Augustine's the breast surgeon.
the breast surgeon.
And so my other question is, when I got the MRI and it was showing the lymph nodes and everything, don't they know that already if lymph nodes were involved? Or is it more another test?
It just shows the lymph nodes are puffy, and but it doesn't tell me whether they're involved or not. Now, after the chemo, when they're removed, that's when we're gonna know. Because even if they were involved when this thing started, when they die and they shrivel up, you will, after you get a bad cold, sometimes the lymph node stays enlarged. So it may still be puffy and enlarged on the MRI, but that doesn't mean it's got cancer in it.
No,
It may
the
all be
MRI
dead.
actually said it was normal size.
Correct. So regardless, and sometimes conversely, you'll have normal size, and you'll still have a little bit of cancer left in it. I'm confident they're gonna hopefully barely find anything.
I started his plate today because he was only 8.
Oh, okay.
he's just not
Good. So
responding,
this'll fix him though.
I'm hoping.
But it's chronic, unfortunately.
I know, but
Unless he wants his spleen taken out.
well, he said if this, because he's failed now everything. So he said, what happens if this doesn't work? I said, then your spleen comes out.
But he needs a marrow before a spleen.
Honestly, but
So even with a mastectomy, you get your lymph nodes taken out?
Yes.
Oh, I didn't.
No,
know
not
that.
all of them. So this is what they do. You got 30 nodes in there. All right. In the old days, they would take them all out, and that's when the women would get lymphedema and so on and so forth. So now what they do is, the lymph nodes are like the links of a chain. All right. There's one, and then it goes to the next, and then it goes to that. The first node that drains the breast is known as the sentinel node. So what do? They inject the breast with a dye.
Oh, so they're going to do what they were going to do before.
You got it.
And look at that.
They inject the breast with a dye, and then it goes to the sentinel node. So they find the node. They take it out. They take that sentinel node out and one or two others. And they have the pathologist literally there in the OR. He looks at it. It's clean or it's got cancer. If it's got cancer, then he proceeds to take out 10 or 11 nodes. If it doesn't have cancer, you stop at the 3 and that's it, and then you don't get anything in the way of lymphedema.
The only thing about the lymph nodes is that, for me, when my lymph nodes get swollen, it lets me know that I'm sick with something. So
Because they're immune organs.
So I kind of need those.
They're not going to remove them all. I guarantee you. But let me tell you right now, you got to know whether the sentinel node is involved or not, and if it is, it's got to come out.
Okay.
If you leave that in there, that's something that could cause a problem in the future. If it's clean, no worries. But either way, they're not going to take all your lymph nodes out. And by all your lymph nodes, I mean just the armpit.
Right.
They're not going to take these nodes out.
Right.
You know that, right? You got nodes all over your body.
Yeah.
We're just talking about what drains the breast. They only take the sentinel. The people that have the kind of responses that you have apparently had, based on the MRI and based on exam, those nodes are going to be clean. I mean, you're not going to have a lymph node dissection. I can tell you right now. They'll take one or two out. They'll be negative, and they'll say that's it. Forget the axilla, do the breast, and we're done.
Praise God. Okay.
Right? It'll happen that way. I'm quite confident.
I'm just trying to
that way.
wrap my head now around finishing this out in the next phase. I'm a little bit anxious about it because
This, in my opinion, because of the length of time and the ups and downs, is the hardest part.
Yeah.
The mastectomy, although it is a procedure and it's surgery and you got to recover, it's short, and your recovery time is a matter of days to 10 days a week. You're gonna be fine. This is almost behind you. This is the toughest part of the journey.
It
Even
is.
radiation isn't that bad.
it's the toughest part, and then I have to go do what you told me to
Physically
do, which is
and mentally.
allow time to pass
You got
and
it.
be okay with being alive.
Right.
And then also, just to tell you one thing, it's been hard for me when I come in here and I see the people suffering. And then seeing that God has healed me.
You
and then
gotta put yourself in. We have two demographics of patients: those that are curable and those that have. Sometimes people come in and the first time you see them, you get a scan. They got in their lung, they got in their liver. They're already metastatic. Those patients are always going to look sicker. Those patients, if they don't get chemo, they're going to die. They're on it chronically.
I know,
They
it
get the
hurts
port
me.
and they get it. But you know what?
I tell people
These are
too,
things
like-
you don't have control over.
And then I also see 20-year-olds in here.
Yeah, I know. We have them. I have a 26-year-old kid with rectal cancer, metastatic. Go figure. But you know, but some of the young ones, they're only getting like iron, they're only getting like
Yeah,
hematology. You
that's
know, we got girls
It's kind
having
of like a
periods.
survivor's remorse, kind of like
Yeah,
that
I
too.
know. I know. That
Isn't that crazy?
that epitomizes the kind of person you are, though. That epitomizes the kind of person you are. You have a soul and you have a conscience.
Mm-hmm.
But you know it there's just so much you don't have control over this.
I know.
There's a higher power
I know.
that you know you just have to go with what's given to you.
I know. I was just thanking Guy earlier.
And if it really affects you that way, once you're said and done, do something.
Oh, I
Give
am.
your time, or
I am.
you know, we
I-
have people that knit stuff, patients. We
Oh,
have
I
people
am.
that.
I plan
so
on doing things to help people out.
that's, I mean, that's. It is what it is.
Thank you.
All right, you're getting your back.
Oh.